Okay, before we came in here, we checked the blood pressure. We checked the vital signs. We checked the height, the weight. Those were all within normal limits. We also assessed the gait and the speech. The patient is dressed accordingly for the weather, and we'll go ahead and get started. Good afternoon, ma'am. My name is Gary. I'll be your nurse today. Today we're going to do a 30-minute check, or we're going to do a full physical assessment. It's going to take about 30 minutes, but if you bear with me, we'll get over it as soon as possible. Okay? I'm going to go ahead and perform hand hygiene, and I've already provided privacy. Okay, so the first thing I'm going to do is just assess the general skin tone. Patient's skin is without lumps, lesions, or abrasions. It does appear to be consistent with the genetic background. I'm going to go ahead and feel the skin. It's smooth. It's not excessively moist. There's no excessive heat coming off. Are you in any pain at this moment? Okay. Next thing I'm going to do is assess the head. It's normocephalic. I don't see any external lumps, lesions, or abrasions or anything like that. So I'm going to go ahead and palpate the head. Okay, note that contour is good. There are no lumps. The hair is evenly distributed, so that's good. I'm going to go ahead and palpate the neck. Push up for me. Good. Now push on my hand. Good. Good. Cranial nerve 11 is intact. The sternocleidomastoid muscles are symmetrical, and the trapezius muscles are symmetrical as well. Next thing I'm going to do is go ahead and I'll palpate the temporomandibular junction. Open your mouth. Good. I didn't feel any crepitations. You feel any pain? No? Okay, good. I'm going to go ahead and assess the lymph nodes at this time. So you have the preauricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. I did not feel any of the lymph nodes. That's a normal finding in the adult. I go ahead and assess skin turgor at this time. It retracted quickly, which means you're well hydrated, so just keep pushing that water, okay? All right, next thing I'm going to get you to do is smile, frown. Now puff your cheeks. Good. Okay, cranial nerve 7 is intact. Now close your eyes and tell me when you feel a touch on your face, okay?
Now.
Cranial nerve 5 is intact. Okay, now clench your teeth and it gets my pressure. Cranial nerve 5 again is intact. Okay, now the next thing I'm going to do is, since I've already assessed the head, is I'll assess the sinuses. So you have the frontal sinus, you feel any pain? And the maxillary sinuses. No pain, she just feels pressure. Okay, so now the next thing I do, since I did assess those sinuses, is I'm going to assess the oral cavity. The lips are symmetrical. There doesn't appear to be any lumps, lesions, or abrasions. And there's no excoriation or excessive redness of the lips or anything like that. So now at this time, I'm going to get you to go ahead and open your mouth. Okay, good. I see the hard and soft palate. The hard and soft palate, they're pink and moist. The uvula, the pillars are pink and moist. The tonsils are present, greater 2+. The oropharynx is pink and moist. Tongue is pink and moist. Oral mucosa, oral mucosa is, or buccal mucosa is pink and moist. Stenson's duct present. They're not inflamed or anything like that. Lift up your tongue. Okay. Frenulum is midline. Wharton's duct present, not inflamed. Okay, you can put your tongue back down. Now open your mouth and say ah. Okay, good. I'm going to stimulate your gag reflex. Okay, good. So cranial nerves 9 and 10 are intact, and again, the teeth are in good condition. There are no caries or foreign debris in the teeth, and there are 28 teeth present. Okay, thank you. Now the next thing I'm going to do is go ahead and assess your ability to taste. So close your eyes and take out your tongue. Tell me what you taste.
Salt.
Good. Okay, so cranial nerve 7 is intact. Now that I'm done with the mouth, I'm going to go to the nose. I'm going to look at the nose from the outside. It's symmetrical, it's midline with the face. There's no excessive redness or inflammation. Next thing I'm going to do is go ahead and palpate the nose. Okay, it's not warm it's not excessively warm to the touch, and is it tender? No? Okay, good. The next thing I'm going to get you to do is go ahead and lean back, and I'm going to assess your nasal mucosa. Okay, nasal mucosa is pink and moist. Turbinates present. There is no bleeding or discharge from turbinates, no polyps present, and also the septum is not deviated or anything like that. So very good. Now again, close your eyes, and I'm going to assess your ability to smell. Cover one nostril, please. Okay, smell. What do you smell?
Alcohol.
Okay, cover the other nostril. What do you smell?
Alcohol.
Good. Okay, so that does it for the nose and the mouth. So the next thing we're going to move on to is the ears. Okay, I'll assess the ears from the outside. They are symmetrical. There's no redness or inflammation with them. There's no discharge coming out of the ear canal. Tell me if you feel any pain when I palpate your ears. The pinna, the tragus, mastoid process, any pain? No? Okay, good. So now the next thing I'm going to do is take a look inside your ears. Okay, so you might feel a little touch here when I put this inside your ear. I know that there's, well, let's see. There's no discharge coming out of the ear canal. Okay. Tympanic membrane, pearly gray. Umbo and malleus are visible. The ear canal does not have any redness or discharge, and the tympanic membrane is not protruding or sunken in, and there are no perforations in the tympanic membrane present. Okay. Can you turn this way so I can look at your eye? Okay, again, I'll assess the same things. Okay, no discharge from the ear canal. Tympanic membrane visible, pearly gray. There's no, it's not sunken in or bulging. Like the umbo and the malleus are visible through it, and the cone of light is at 5 o'clock, or 7 o'clock in this case. It was at 5 o'clock in the right ear. Okay, so the next thing I'm going to do is assess your ability to hear. So cover one ear for me and tell me what you hear.
1, 2, 3.
Good. Now the other ear.
ABC.
Okay, so cranial nerve 8 is intact. The next thing I'm going to do is go ahead and do the Weber test. I'm going to put this on top of your head. Just tell me if you feel the vibrations equally in both ears, okay? Equally?
Yes.
Good. Okay, the next thing I'm going to do is called the Rene test. I'm going to put this on your mastoid process. You're going to hear vibration, and then I'm going to put it in front of your ear, and you're going to hear it then. So tell me when you stop hearing both, okay?
Now. Now.
Good. Air conduction was twice as long as bone conduction, so that's very good.
Now. Now.
Good. Air conduction, again, was twice as long as bone conduction. Okay, well at this time, again, cranial nerve 8 is intact. We're done with the ears, so I'm going to move on to the neck. Okay. Thank you. All right. First thing I'm going to do with the neck is assess the thyroid gland. So lean to the right. Okay, and swallow. To the left. Swallow. Okay, I could not palpate the thyroid gland. That's normal finding in the adult patient. So now the next thing I'm going to do, it's assessed for tracheal deviation. The trachea is midline. There's no deviation with the trachea, so that's very good. Next thing I'm going to do is assess for the carotid artery pulsation. Present 2+. Present 2+. At this time, I'm going to go ahead and auscultate the carotid artery. No bruise present in the carotid artery. I'm going to go ahead and auscultate the trachea while I have my stethoscope out. good. The sounds were high-pitched and loud in the bronchial sounds, so that's exactly what I was expecting. Okay, now at this time, I'm going to assess the thoracic cavity, or the thoracic cage. It is symmetrical. The patient's not leaned forward or having any bouts of dyspnea at this time. The skin color is good. There's no cyanosis or paleness or anything, so oxygenation appears to be good from what I can see from now. This thoracic cavity is elliptical and symmetrical, and the anterior-posterior diameter is less than the lateral diameter of the thoracic cavity. So now at this time, I'm going to go ahead and assess for the heart sounds. You have the aortic valve in the second intercostal space on the right side, the pulmonic valve in the second intercostal space on the left side. You have the tricuspid valve in the fifth intercostal space toward the midline, but still in the space. And then you have the mitral valve in the fifth intercostal space, mid-clavicular line. I do hear S1 and S2. S1 precedes S2. S1 can best be heard at the apex. S2 can best be heard at the base of the heart. S1 would be the love and love dub. Now this time we'll go ahead and assess your, this time I'm going to go ahead and assess for symmetric expansion. So I'm going to put my hands here and just breathe deeply. Good. The thoracic cage did expand symmetrically. My thumbs moved apart. So now I'm going to assess tactile fremitus. So it's 99 every time I touch you.
99, 99, 99, 99, 99.
I did hear or feel vibrations throughout. So now this time I'm going to go ahead and percuss. Okay, I did hear resonance throughout, so that was a normal finding. At this time, I'm going to go ahead and auscultate once more to the respiratory sounds now. So. Under your shirt here. Good. All right. Okay, good. The vesicular sounds were low and soft throughout, so that's what I was expecting. And now I'm going to listen to the bronchovesicular sounds. Okay, the bronchovesicular sounds were moderate in tone, and inspiration and expiration were of equal length in the bronchovesicular sounds. Okay, so now at this time, I'm done with the anterior thorax. I'm going to move to the posterior thorax. Just move this way. Okay, again, I already said that the thoracic cage was symmetrical, elliptical in shape. Anterior-posterior diameter was less than the lateral diameter. But what I want to note on the back side is that the scapula are both at the same height and equal, and then also that the spine is in a straight line. And it wouldn't be if there was, say, scoliosis or something like that. So the first thing I'm going to do is palpate again. Breathe deeply. Okay, I did have symmetric expansion with that test. That's what I was looking for. So now the next thing I'm going to do is, again, tactile fremitus. So 99 every time I touch you.
99, 99, 99, 99, 99, 99.
Okay, good. I did feel vibrations throughout. At this time, I'm going to go ahead and percuss. I did hear resonance throughout, and that's what I expected to find, so that was very good. And now I'm going to listen to the vesicular sounds and the bronchovesicular sounds. I'm going to go up under your shirt. Vesicular, bronchovesicular are going to be right close to the midline. Vesicular will be a little farther out, but still within the scapula. Okay, and once again, vesicular sounds were low and soft. Now I'm going to listen to the broncho-vesicular sounds once again. Again, these are more toward the midline since you can't see what I'm doing. Pretty much on either side of the vertebral column. Okay, and the broncho-vesicular sounds were moderate in tone and intensity, and inspiration and expiration were equal for those. Okay, now at this time I am done with your posterior thorax, so I'm going to have you go ahead and lay back. And I'm going to move to the abdomen. Are you okay? Okay, so I'm going to need you to pull your shirt up. Okay, good. So the first thing I'll do is just take a look at the abdomen. And it is flat. The belly button or the umbilicus is inverted and midline. There are no lumps, lesions, or abrasions. There does not appear to be any distension. I do see the aortic pulsations in the movement with breathing, but there are no other pulsations. So at this time, I'm going to go ahead and auscultate. Starting in the lower right quadrant. Vowel sounds present in all four quadrants. I'm going to go ahead and auscultate the blood vessels. Aortic, renal, iliac, and femoral at the very bottom. I did not hear any bruits in these arteries, so that's what I expected to find. Now that I've auscultated, I'm going to go ahead and percuss, noting the general tympany. A little more dull right here over the liver on the right upper quadrant. A little more tympany evident over the gastric region. Okay, and I've noted the general tympany. There wasn't good tympany throughout. Again, more dull over the liver, more resonance or more tympany over the stomach. So that's what I expected to find. At this time, we'll go ahead and palpate, so just relax. First is light palpation. I'll note the general muscle tone. She's not guarding or anything like that, so there doesn't appear to be any pain. And the general muscle tone is good. So now I'm going to go for a more deep palpation. I want to try to palpate for the liver, and I can just barely feel it up under the thorax. And I want to assess for tenderness and assess to see if I can feel the spleen. Any tenderness? No. Okay, good. I could not feel the spleen. I'm going to try to feel the kidneys. Okay, and I could not feel those, and there were no lumps or distension or anything that I could feel within the abdomen. So now at this time we're done with your abdomen, and I can get you to go ahead and sit back up. Okay, so now at this time I'm going to go ahead and do the pulses. I'll start with the radial. Present 2 plus. Brachial. Present 2 plus. Posterior tibialis. Present 2 plus. And the dorsalis pedis. Present 2 plus. And while I'm down here, I'm going to go ahead and do the capillary refill. It's hard to tell with the toenails, but if she did not have toenail polish, then I'll be able to assess it a little bit better. Since the pulses were good, I can tell a little bit when I just press on the skin, but since the pulses were good, I'll have to go with that. Capillary refill on the fingers is good. It was about a half a second, so it was within the 2-second limit, and that's very good. So now, at this time, I'm going to get you to close your eyes and put your hand out. I'm going to put something in your hand, if you can just tell me what it is. Good. Okay, now in your other hand, I'm going to draw something on it. A number. Tell me what number I draw.
8.
Okay, so stereogenesis and graphesthesia are good. That just tests sensation, so that's very good. Okay, now the next test I'm going to do is I'm going to go ahead and do the reflexes. So the first reflex I'll do is the triceps, so just relax. Good. Present 2 plus. Relax. present, 2 plus. I'll go ahead and move to the biceps right here. Good, present, 2 plus. Good, present, 2 plus. Now the patellar. Good, present, 2 plus. Excellent, present, 2 plus. Okay, now in the Achilles. Excellent, 2 plus. Good, 2 plus. Okay, now hold your arms up like this. I'm going to test muscle strength. Push against me. Good, now pull. Good, now with your legs. And pull. Okay, good. Muscle strength was good in the upper and lower extremities. So now this time, I'm going to get you to go ahead and stand back up, or stand up for me. And I'm going to assess range of motion. So the first thing we're going to do is assess range of motion in the neck. Try to touch your chin to your chest. Good. And now chin to the sky. Good. Right ear to right shoulder. Good. Left ear to left shoulder. Good. Did you feel any pain? I didn't feel any crepitation, so that's very good. Now we're going to check the range of motion in the right shoulder. So abduct, adduct, and circumduct. Good. Did you feel any pain? I didn't feel any crepitation. Again, abduct, adduct, and circumduct. Any pain? I didn't feel any crepitation either on there. So now we're going to do the the other range of motion for the shoulder. Any pain? No? Okay, and then inversion. Good. Any pain?
Yep.
I didn't feel any crepitation. So eversion and inversion. Any pain? Good. I didn't feel any crepitation there either. Okay, so now the next thing I'm going to do is assess the range of motion in the back. So lean over. Good. Now stand back up and lean back. Good. Now to the right. Good. And left. Good. Any pain? I didn't feel any popping or crepitation there either. And while I'm assessing all of these joints, I want to feel for any swelling or pain. Again, I've been asking for about pain, but definitely heat and swelling are other things I want to note. And I don't feel the heat or swelling in any of these joints. So go ahead and raise your leg up. We're going to assess your knee range of motion. Good. No pain? Okay, good. I didn't feel any crepitation there either. So now I'm going to have you just sit back down real quick, and I'm going to do the range of motion for the feet. So press the gas pedals. Good. Now lift up off of them. Good. Now invert. Good. And evert. Excellent. No pain? Okay. Now do the contraction for your bicep. Now extension. Good. No pain? I didn't feel any crepitation. Contraction. Extension. Good. Okay. Now this time I'm going to get you to stand back up one more time. Sorry about that. I'm going to do what's called the Romberg test. You got to close your eyes and just try to stand still, okay? I don't see any excessive swaying, so that's the normal finding. Okay, that's fine. Now if I can get you to have to walk heel to toe about 5 or 6 steps and then backwards the same way, okay? Balance is good, cerebellar function appears to be fine, and that also tests the vestibular apparatus. Okay, so now the next thing I'm going to do is I'm going to have you sit back down one more time. I forgot to check your eyes out, so I'm going to go ahead and do that. Okay, the first thing I want to do with the eyes is do the Snell and eye chart. So hold this about 14 inches away and read the lowermost line you can with your right eye. Cover one eye.
3742 SS.
Good. Now the left eye.
3742 SS. What was I?
Okay, excellent. Cranial 2 intact, and basically you have 20/20 vision, so that means you can see at 20 feet what the person with normal vision can see at 20 feet. Okay. Okay. The next thing I'm going to do is the cover test. So I'm going to put this over your eye, over one eye, and just focus on that distant point on the wall. Okay. And I'm just going to put this over your eye. Okay. The eyes did not move, so they stayed in alignment the whole time, and that's what I expected to see. Now the next thing I'm going to do is I'll have you hold this over your right eye, and I'll hold this over my left, and just tell me when you see my finger, okay?
Now. Now. Now.
Good. Now the other eye?
Now. Now.
Good.
Now.
Okay, visual fields are normal by confrontation. Now I'm going to do the diagnostics position test. So just follow my finger and try not to move your head, okay? Okay, cranial nerve 3, 4, and 6 are intact. Okay, now the next thing I'm going to do is I'm going to go ahead and just inspect the external structures of the eye. There is no redness or inflammation. The eyebrows, eyelashes are present. The eyeballs are spherical, so that's good. I'm going to assess the lacrimal apparatus. Any pain?
No.
I don't see any redness. Now look up. Sclera or china white, conjunctiva are pink and moist. Okay, now I'm going to, before I do that, one more thing. Again, I'm going to have you focus on that distant point on the wall. Okay, and I'm going to note where I see the reflection at. Okay, the reflection is in the same spot in both eyes, and that's what I expect to find, so that means the eyes are in normal alignment. So now stay focused there, and I'm going to just let your pupils dilate for a second. Okay, good. Both pupils did constrict. There was the reflex constriction on the opposite side, but I'll just go ahead and do it on this side. Good. Again, they did constrict. And now stay focused there, and when I put this pin in front of your face, I want you to look at it, okay? I'm going to check it for accommodation. They dilated, so good. Pupils did constrict. Accommodation is good. So now at this time, I'm going to go ahead and take a look at the internal structures of the eye. I need you to put your feet over here. Just this isn't long enough to reach. Okay, so I'll come in at about 15 degrees. Red reflex present. Retinal arteries and veins paired and no crossing defects. The optic disc is creamy yellow. Okay, good. Now I'm going to assess your left eye. Again, about 15 degrees. Red reflex present. Optic disc creamy yellow. Retinal veins present or paired, and there are no crossing defects. Excellent. Okay, so now I'm just going to refer to my chart and make sure I haven't forgotten anything, but I think we're just about done, okay? Wait a minute, so just, yeah.